All right, so talking about schizophrenia, talking about the developmental course, subtypes, and then finally we'll end with a discussion of delusional disorder. Okay, so the course of schizophrenia. Schizophrenia follows a course where first the individual is in the prodromal phase, and prodromal means the period before the symptoms actually start to appear. And this can be applied to any psychological disorder, but applied to schizophrenia, we're looking at the clear appearance of psychotic symptoms. So prodromal phase happens first. There's gradual deterioration of functioning. Then the client enters the active phase on this downhill slide, from prodromal into the active phase. And during this phase, the patient likely shows some prominent symptoms of schizophrenia. Following that is the residual phase. So during the residual phase, the patient shows behavior that is similar to the prodromal phase, such as blunted or flat affect. Some patients can actually return to their normal level of functioning. So functioning, at a higher level than previous to the prodromal phase. More typical pattern is increasingly impaired functioning between episodes of residual phases. So basically the idea here is that individuals with schizophrenia tend to kind of get worse as they grow older. Okay, so looking at the developmental progression. So childhood schizophrenia is very, very rare, but I will direct you to one of the videos for this particular chapter that does show a case of childhood schizophrenia. But again, in clinical practice, it's very, very rare to see that. But there are some signs that you can actually look for in childhood that could indicate that these are precursors or risk factors for schizophrenia. And researchers come up with these particular risk factors or these signs by examining home movies of children, of adults when they were children, and they develop schizophrenia later on down the line. And they also look at things like, interviewing the parents, interviewing family members to get some kind of corroborative report here. So in childhood, they have found that these children tend to be less responsive in social situations. So that relates to the social withdrawal that individuals with schizophrenia experience. Tend to show less positive emotions, so things like smiling, like being happy, showing excitement and joy. So that relates to problems with emotion or affect that we see in individuals with schizophrenia. Cognitively, their IQ tests and grades in school tend to be lower compared to their peers. And into adolescence, so this is becoming a teenager, we see that there's a gradual increase in adjustment problems. So, keeping in mind development and what's normative or what's normal for this particular period in time, most individuals in adolescence are trying to differentiate themselves from their families, right? They're trying to spend more time with friends, less time with family. So they're really getting into the social scene. Individuals who develop schizophrenia in adulthood are more likely to show depression, but also the social withdrawal. So they're not really interested in seeking out these social relationships the way that other individuals in adolescence are likely to be doing during this particular point in development. So there are subtypes of schizophrenia, and the subtypes of schizophrenia basically try to categorize people based on a cluster of distinct symptoms. So there are 4 different subtypes of schizophrenia. First is the disorganized. As the name suggests, individuals with this subtype show the disorganized speech. They use the neologisms, the clanging, the word salad. They have disorganized behavior, so they have a lack of goal orientation. They don't really know what they're doing. They really have no interest in keeping to any kind of a plan or any kind of a goal. Showing problems with affect, and these individuals actually have the worst prognosis of all of the subtypes that we'll talk about. So the onset for this is usually gradual and occurs at an earlier age compared to the other subtypes. And additionally, this disorganized schizophrenia subtype most closely fits the stereotype of, what you would think a crazy person would look like. That's disorganized schizophrenia in action. Okay, the second subtype, this catatonic schizophrenic subtype, you probably recognize that word, catatonic, related to problems with motor behavior, or problems with movement. So remember last time we talked about a catatonic stupor, where individuals are completely immobile for a period of time. So they go into those really odd behavioral poses. Usually these poses are accompanied by mutism. So this means they are not talking. They may also engage in stereotype movements, so arm flapping, things like that, and echolalia. They'll often repeat other people's words, and echopraxia, repeating the actions of other people. Paranoid schizophrenic subtype, these individuals have delusions and or hallucinations related to themes of persecution and grandeur. This is far more common for a schizophrenic subtype than either the disorganized or the catatonic types. Individuals who fall into this category often show better functioning and are more, quote, normal than disorganized or catatonic types. Usually with this particular subtype, the active phase appears after 25 years of age and is preceded by years of fear and suspicion. But it does have the best prognosis of all of the subtypes of schizophrenia. Okay, so let's talk about delusional disorder. So delusional disorder is separate from schizophrenia, but nonetheless kind of falls into a similar category here. With delusional disorder, some kind of delusional system, so some kind of delusional belief system is the hallmark of this disorder. But for all intents and purposes, aside from the delusion that this individual holds, otherwise this person seems pretty normal, and you would never know that they have some kind of abnormal behavior going on, because otherwise they look like they're pretty normal. With delusional disorder, hallucinations, disorganized speech, and disorganized behavior, and the negative symptoms of schizophrenia cannot be present, okay? If those are present, the diagnosis will likely shift to schizophrenia. So with delusional disorder, the individual maintains a delusional belief system, and that delusional belief system can fall into one of these 5 different subtypes here. So with the persecutory subtype, this individual has some kind of belief that he or she is being threatened or maltreated by others. With the grandiose subtype, the person believes that they are endowed with extraordinary power or knowledge. With the jealous subtype, this is the delusion that one's sexual partner is being unfaithful. With the erotomanic subtype, this refers to the belief that a person of high status is in love with you. Okay, so a famous person is in love with you, and this can obviously lead to extreme behaviors, right? Like stalking very famous individuals. Somatic subtype involves this false belief that the individual is suffering from a physical abnormality or a disorder. So you might believe that your body emits some kind of foul odor, that you have insects on your skin, or that you have internal parasites. So the somatic subtype then differs from body dysmorphic disorder, which we talked about in the chapter on somatoform disorders. Many individuals with body dysmorphic disorder realize that their beliefs are distorted. However, if they hold these beliefs with delusional conviction, so that is, if they don't have any insight into how distorted their beliefs are, if they truly, truly believe that this in fact reflects reality, then you would diagnose an individual with both body dysmorphic disorder and delusional disorder, somatic subtype.